I'd like to begin by first prefacing that I know there are a large number of videos out there with very catchy titles promising relief from everything from depression to anxiety to whatever ails you. And once you click on the video, it ends up being nothing more than a marketing tool to lead you to a website or to buy a product or a system or something else. I want to make it clear that I'm not selling anything. I have no website to link you to, and this is just purely informational and hopefully something that can help you. On the same note, I do also want to preface once again that the information in this video is not a substitute for medical or professional advice and is purely informational. The purpose of this video is to address an issue that affects a large number of people out there, and it crosses all areas of life, from PTSD to weight loss to depression, anxiety, to financial freedom, to financial success, anything that a person wants to accomplish in their life that they have trouble doing. And the question is, it's understandable that somebody may want to encourage somebody else to do something, and the other person resists or gives them a hard time or refuses. That's normal. The question is, why would an individual have a hard time accomplishing something on their own? In other words, if a person suffering with PTSD, a soldier who returned from war has PTSD, Posttraumatic Stress Disorder, and they're suffering from a condition where the brain is behaving, and their body, their nervous system, is behaving as though they're still in a battlefield, while in fact they are not in a battlefield. They're now back home and safe. So the individual is aware of the fact that they're now safe, yet at the same time their brain is behaving differently. And the brain that this person is trying to modify, to change, is their own brain. And similarly with weight loss, you have somebody who is miserable being overweight or obese. They want to lose weight, and they're not trying to convince somebody else to lose weight. It's them who have to lose weight. And anybody who has trouble losing weight will tell you that their biggest enemy is themselves. They want to lose weight, but there's something inside them that is resisting, that's pulling them back and enticing them to overeat or to make unhealthy choices. So the question is, it's understandable if a health coach is trying to encourage a patient to lose weight and the patient or client is not cooperating. But the frustration begins when the person who is not cooperating is the person who is trying to lose the weight or to recover from their depression. You can have somebody with depression who understands on a conscious level that there's nothing to be depressed about, or somebody with anxiety who understands that there's nothing to be anxious about, but who is constantly drawn back into a state of depression, anxiety, or post-traumatic stress disorder, or back to overeating and overweight and obesity. Why are we fighting ourselves? Why are we fighting ourselves when we should be on the same team? We should be working with ourselves and not resisting ourselves. So that question is the key, the answer to that question at least, is the key to the failure or the difficulty or the challenge in accomplishing any goal in our lives, including financial and finances, health, etc. when a person wants to be wealthy, wants to succeed, wants to have a good job, and looking for a good job, but there's something inside them, and I'm not referring to when there's no opportunity. I'm referring to when a person is being held back by their own doubts, by their own low self-esteem, by their own insecurities. And again, the question is, why would we be fighting ourselves when we're supposed to be on the same team? We're all trying to be healthy. We're all trying to be wealthy. We're all trying to have a positive mental health circumstance. So to give a brief overview of the underlying issue, which I'll do in this video, I would like to give you some background. But before I do that, I want to address the common theories that are out there, because this has been addressed before. But obviously, whatever method is being addressed is obviously not working, because we're still struggling and we're still having the same issues before we read the self-help book that seem to address it. And in future videos, I'll dissect each category and each area in more detail, and I also plan to add some videos with guided meditation and hypnosis and suggestions that will hopefully be able to make the changes necessary to address the underlying issues that are holding us all back. So the solution that is out there, the commonly held solution, is the issue of the paradigm. You can search for videos about the paradigm shift, and the theory there is that, and again, there's a lot of truth to it, but obviously it hasn't solved the problem for the majority of the population, or many people for that matter. In that theory, the brain, or the subconscious part of the brain, is seen as the sort of the basement, or the holding area for all of the information that the person learns about life during childhood, during the developmental years, and that information is stored there, and that information shapes the conscious mind. In other words, if the person was told as a child that they will not succeed and will never be successful, the brain is now filters out any messages that contradict that paradigm, or that core information. So if the person throughout life receives information that matches with the message, with the core message, with the underlying message that they will never succeed, then that information is not only accepted, but it's enhanced and confirmed going forward. Information to the contrary, however, such as information about the person's ability to be successful, that information is filtered out, because it's not compatible with the paradigm information, the information in the holding area of the brain. So the solution based on that theory is to change the paradigm to which includes affirmations and other tools to change the paradigm, so that the information now allowed in will be more in line with success and health, and the information that will be filtered out is information that contradicts that. So again, there is some truth to that, and it does take a lot of work, and if that's worked for people, then I'm happy to hear that. But what I found to be the fundamental issue that results in the struggle that we all have to move forward in life, to come out of a state of depression, a state of anxiety, to achieve wealth, to to basically accomplish anything that we're unable to accomplish simply because we're being held back by an underlying force, such as, and the most prominent areas are weight loss and PTSD, where the person is so motivated and so aware of what the current state of reality is and what would benefit them and what would allow them to enjoy life, yet there's something that's pulling them back, and it's not allowing them to accomplish what they need to. So my theory goes as follows, and again, I've seen a lot of success with it, and if you do too, then that would make this worthwhile. There's an issue in psychology, a concept in psychology called consolidation. There are two issues that I'm going to discuss. The first one is consolidation. The second one is called splitting off. And those two concepts, those two phenomena are the underlying mechanisms that take place that result in a state that the subconscious mind enters into, that is extremely difficult to pull away from. But there are tools that do allow you to, and I will get to the tools as well. And the tools I have to say are extremely effective as well, as I've seen in practice. So the consolidation is when the brain experiences an extreme and devastating trauma. It consolidates that memory. It consolidates that feeling. That whatever it feels at that moment becomes ingrained in the brain, in the parasympathetic nervous system, in the limbic system. But the way the brain works is as follows. The limbic system controls the autonomic nervous system, which consists of two separate entities, one of which is the sympathetic nervous system, and the second is the parasympathetic nervous system. Now, the amygdala, which is a portion of the limbic system, it's a part of the limbic system. The amygdala is the part of the brain that remembers trauma, remembers danger, and remembers situations where the person was at risk and the fight or flight mechanism was required. Now, if there's a passing and a transient state of danger or trauma, the brain has no reason to remember that circumstance. It was a one-time thing. It engages the sympathetic nervous system, which is the fight, flight, or freeze mechanism. The person panics or reacts instantaneously by tensing up, by dilating the pupils, by increasing the heart rate, by increasing blood flow to the muscles, etc. The person goes into a panic. Norepinephrine and noradrenaline are released, and the person reacts to that danger, and the brain has no reason to register that danger because of the fact that the brain understands that it was a one-time occurrence. And to hold on to that memory would actually be counterproductive because it would be using brain space that can be used for other things that may come up in the future. However, when a person is exposed to an overwhelming trauma or a prolonged state of trauma, then the brain, to become more efficient, will consolidate the memory of that trauma. It'll implant it in the amygdala. The amygdala will implant it as a steady state of being. What that does is it allows the brain to always be ready for that trauma. In other words, the next time that situation happens, the brain does not have to compute or take note of what's happening. And although that happens within moments, within milliseconds, the brain does not have to do that because it's already geared up for that state of trauma, for that situation, because it's been so prolonged and so pervasive and so overwhelming, or one or both, the brain prepares itself to more efficiently and quickly respond next time by remembering this as the steady state of existence. So if a person was raped and the trauma was so overwhelming, then the brain will try to remember or consolidate that state of being, that state of overwhelming trauma, um, so that and to the point where it will consider itself in constant state of threat and danger of being raped again. Once that happens, and the person is no longer in a state of danger, the brain, however, has consolidated that memory or embedded that memory so deeply that it cannot then change that easily. It's preparing for that danger to the point where it does not register the fact that the danger has passed. So although the person at a conscious level in the prefrontal part of their brain may now see on a conscious level that they're no longer in danger, the brain, which has already recognized that, for example, a deep male voice similar to that of the rapist, if that were the case, the sound of a deep male voice approaching equals rape, then anytime the person hears a deep male voice, they will believe that they're going to be raped. Or if somebody was in, and that's the brain's way of not having to process what a deep male voice means. It's the brain's way of now being more ready and more prepared to respond instantaneously to that danger. Or when a soldier hears a loud sound while walking down the street back in their hometown, the brain already, for the sake of efficiency, primed itself to react to any loud noise as though the person were under attack by mortars or other types of explosive devices. And the reason that occurs comes down to the famous Pavlovian conditioning, which is called classical conditioning, where the brain is designed to not only react to an actual stimulus or to actual stimuli, such as food or actual danger, again, in an attempt to be efficient and prepared, the brain looks for antecedents, for circumstances that precede the danger, so that instead of waiting for the danger to come, the brain looks for something even before that, an early warning system, such as a deep male voice of a kidnapper who is constantly raping a victim, hostage. That deep male voice approaching, or the footsteps of that deep male voice of that male approaching, are already engage the sympathetic nervous system to react to danger, so that the brain of the person does not have to wait those precious moments until the actual danger takes place. Similarly, a soldier who returned from war, a military veteran, does not have to wait until they see body parts flying or an explosion taking place. Just the sound of a loud sound that may even indicate that may be an explosive device is already enough to engage the fight or flight system, or the sympathetic nervous system, excuse me, so that the person can react quicker. So, as the Pavlovian, the famous Pavlovian experiment was where Pavlov was a Russian scientist. He had dogs that he would feed. He was testing their saliva, because he wanted to test their digestive juices, and the only way to test digestive juices at that point, without killing the dogs, was to encourage the digestive juices to come out of the body. And the way to do that was to encourage salivation. So he would have an assistant feed the dogs, and every time the dogs would see the food, they would salivate. Eventually, they would begin to salivate at the sight of the assistant, and then that was again the dog's brains attempting to be more efficient, and instead of waiting to see food and react to it by salivating, it would react earlier to the earlier warning system. In this case, not a warning system of danger, but a warning system nonetheless. And they would react just at the sight of the assistant before even seeing the food, or even when the assistant did not have food. He repeated the experiment by ringing a bell and then feeding the dogs, and eventually they would salivate just at the sound of the bell. So similarly, our brains are designed to look for early warning systems and to react to those. Once it does, it begins to consolidate those memories to be further prepared in the future. So again, these are all positive defense mechanisms, but obviously when the brain uses them in situations where they're hurtful, they can cause a lot of distress. But it's important to realize that they're fundamentally systems that are designed to help us react to danger a lot more efficiently. And I'm going to go off a little bit on the issue of understanding that these are beneficial systems. A lot of, before even getting to the main issue here, a lot of the resistance to healing is the fact that people begin to fight with themselves. They see their brains as the enemy. They see their anxiety symptoms or their depression symptoms or their PTSD symptoms as the enemy. They want it to go away. They want it to stop. It's hurting them. And it's a general rule that when you fight something, when you resist, you usually lose. And that's similar with to somebody who's being pulled away by a riptide. The rule of thumb is to not fight against the current, but to go with it and to work with it and go sideways, perpendicular to it. But the key is to not resist, because when you resist, you're doomed. And as long as we're going to see our brains as an enemy and see our PTSD symptoms or our anxiety or our depression or our inability to lose weight or our difficulty losing weight, because I wouldn't call it an inability because I don't believe it's not possible, as you'll see further. As long as we see it as an enemy, we're guaranteed to fail. We will not succeed. We have to begin to dissect each thing that we don't appreciate, each thing that gives us distress, such as depression, anxiety, or whatever it is, and weight gain, and to try to understand why our body is doing it. Why is our brain doing this to us? How is it trying to help us by doing it? Because our brain has a few set goals. The first is to keep us alive. The second is to keep us from harm. The third is to reduce pain, and the fourth is to encourage comfort. Those are the fundamental jobs. Now, the brain may do things that we don't like in its attempt to do so, but if we understand what it's doing and we appreciate and respect what it's doing, we can work with the system and stop resisting it. For example, somebody who's constantly gaining weight and they're trying their hardest to lose weight, they usually look at their body as the enemy. And they'll say, look what my body's doing. I eat a donut and it puts it straight to my thighs. Or I eat this and it stores it. And look what my body's doing. My body just doesn't want to lose weight. My body's just resisting. It's just fighting me. It's fighting me. And I'm going to fight back. I'm going to control myself. I'm going to resist. I'm going to win. I'm going to conquer it. I'm going to battle it. I'm going to have self-control. And the body is the enemy. The brain is the enemy. And we're going to fight these temptations. We're going to fight these cravings. We're going to override these temptations. And that's a guarantee, a proven guarantee of failure. You will never win when you resist. And with weight loss, as I'll describe in more detail in the future, the key is understanding why our body gains weight, why our body encourages us to eat when we've eaten enough, why despite the fact that we consciously want to lose weight, why does our brain continue to drive us to eat foods that will cause us to gain weight? Why do we have PTSD? Why do people who experience trauma have PTSD? It's not the enemy. And sometimes, even in psychology and psychiatry, it's treated as the enemy. We're going to fight those symptoms by taking this pill and that pill. There's nothing wrong with taking the pills that a doctor prescribes, but the mode of taking the pill cannot be to fight and to win and to override, because then we're just fighting and we're resisting, and then it's going to fight back, and guess what? It's always going to win. PTSD, again, as I described earlier, is not our brain's attempt to hurt us. It's our brain's attempt to help us be more prepared for danger that may reoccur. Now, we know it's not going to reoccur, but our brain doesn't know that. But if we understand that our brain is trying to help us be prepared for danger, now we understand that our brain is the friend here. It's our ally. It's not our enemy. And similarly with depression, anxiety, these are all mechanisms that are built into the brain to encourage us to become better people. Depression is a mechanism that allows us to not be happy with the status quo, and it's supposed to encourage us to do better. Anxiety is similar to PTSD. It's a fight or flight. Our brain is trying to help us run from danger. Now, why do we call it an anxiety disorder? Because the fact is, it is out of proportion to the reality. There is no danger that demands that type of reaction, and that's understood. But we first need to understand that our brain is not fighting us. It is our friend. It is working with us. It is trying to help us. Sometimes it's misguided in its attempt to help us. Just as with weight loss, our bodies are designed to prepare us for times of famine. It will do that regardless of what we try to do. It is trying to help us, not the enemy. Your body is not trying to resist your attempt to lose weight. It is not trying to fight you or make you fail. Your body is not there to hurt you. It's there to help you. Your body wants to stay alive and healthy just as much as, if not more than, you do. And it believes it will do so by storing energy, by storing fat, by storing the calories in your food for a future time. Now, once you understand that it's trying to help you, and that when you diet and you're restricting it, it starts to sense that it's in a famine, and to help you, it now encourages you to eat even more because it's sensing a famine, or what you call a diet or a food restriction regimen or whatever it is. Your brain is trying to help you. So once you understand that you gained the weight because, once a person understands that they gained the weight because their body was trying to prepare them for famine, and that their body is seemingly resisting their weight loss attempts simply because it senses danger and is trying to help you out of that danger. Once you understand that, now we can start the healing. But the first step is to understand that our body is not the enemy. To understand that our body is designed fundamentally to do exactly what we want to do at our core, to keep us alive, healthy, safe, free of pain, and as comfortable as possible. And because our body has mechanisms to try to predict danger, and once it senses overwhelming danger, it'll lock in those memories and react to them even when there is no danger. That's where the brain tries to help us when we don't need help. And that's when the key is. That's when the key problem begins, when our brain tries to help us when we don't need help. Our brain is not trying to hurt us. Again, it's trying to help us. The only issue is that we don't need help now. A soldier who has now returned home and is out of danger, their brain is still trying to protect them from danger. It is not trying to give them debilitating symptoms or disability. It is trying to help them. The only problem there, and I don't mean only to minimize it, what I'm saying is that the fundamental problem is that they don't need help anymore. And that's where we have to tell the brain we don't need help anymore. Or somebody who is overweight, their brain is still trying to store energy and fat in the fat cells to prevent them from starving in the future. But right now they don't need that help because they're already overweight. So the brain needs to be modified to understand that thank you for trying to help me, but I don't need your help right now. Thanks, but no thanks. Not too bad, not I hate you, not stop what you're doing. Thank you for helping me, but I don't need your help right now. But I appreciate your attempts to help me, and I understand that everything you're doing is in a pure attempt to help me and to keep me alive and safe and healthy. And that goes across everything. Again, understanding that our brain is on our team, is trying to help us. In the next video, I'll delve deeper into how to now train the brain that we don't need its help anymore. That's the key here. But before even training the brain to understand that we don't need its help, we need to first understand that the brain is trying to help us, and to stop treating it as the enemy and resisting and overriding, because that, as we all know, is doomed to failure. And again, in the next video, I hope to start touching upon the healing process. Thank you very much.